Welcome to Clear the Air with me, Angela Lim, medical doctor and co-founder of Clearhead, an innovative employee wellbeing platform. Clear the Air is a podcast covering those experiences in your life or questions you have that you feel too vulnerable to share with those around you, such as, why do I feel so lonely? And what can I do to feel happier? We get real and raw on these existential questions on mental health and well-being that's puzzled humans for millennia, sharing the science behind what you're experiencing and the answers behind those questions. Addiction or substance abuse is a major global issue. While it may be seen as part of our culture to use alcohol or even recreational drugs to unwind and celebrate important milestones, substance abuse often goes unnoticed until it has already taken a toll on our relationships, personal safety, and mental health. The Alcohol and Drug Foundation states that 1 in 3 adults drink alcohol at a level that puts them at risk of alcohol-related disease or injury. And as we kick off the new year right off the bat of the festive season, it's the perfect time to do some self-reflection. In this episode, we'll be unpacking how and why people become addicted to substances and what we can do to overcome our addiction. And to help us guide through this topic, we're pleased to have Dr. Kenneth Leonard join us. He is the director of the Clinical Institute on Addictions and research professor in psychiatry at the University of Buffalo's Medical School in New York. He is a member of multiple research journals at editorial boards and various research organizations specialising in alcoholism. Kenenth is internationally recognized for his research on the impact of substance abuse on relationships and has published more than 200 articles, including on the topic of alcohol's influence on domestic violence and child development, and of course the role of family in the prevention and treatment of addiction. Welcome, Kenneth.
Thank you very much.
Well, Ken, would you like to maybe start us off with what got you involved in this area to start off?
I actually started off as a violence researcher in graduate school, and the person I was working with happened to get a grant to look at alcohol and violence. And so when I got my doctorate, there were a lot of places that were interested in alcoholism that were interested in me as a postdoc, and so that sort of became the natural progression for me.
Obviously, you've been doing this research now for quite a while, and one of the things you really wanted to ensure that we get out of this session was to not convey addiction as this black and white situation, whether you're either addicted or not, but actually it's more of a continuum with different levels of dependencies, and most of us may be affected at some point in our lives. So maybe you could expand a little bit more on this idea of what is addiction and how does that relate to someone's mental health.
So one of the things to understand about addiction is that it's a process that comes about largely because of regular and excessive drug use. And then as the addiction develops, it also is a cause of continued alcohol or drug use. So the way I think about it is that there are a lot of reasons why people will drink heavy and regular, for example, and some of those may relate to issues of mental illness. Sometimes it's just the social setting, and they come to learn that alcohol is functional for them, that it serves a purpose, that it makes them relaxed, that it makes them less anxious in situations. And so a lot of times the initial substance use is more about recreation. It's more about positive affect than it is about mental illness. However, as time progresses, a lot of times the mental illness is something that is the symptoms of the mental illness are sometimes alleviated to some extent by the use of the substances. And then the other aspect about that is that there is there is a genetic component, and that genetic component is linked to a variety of different mental illnesses. And there's an early childhood development that's linked to substance use, but it's also linked to depression and anxiety and other sorts of mental illness.
So maybe let's, start a bit broader. As you mentioned, for some people, the reason for using substances is that they have mental health challenges. But for a lot of people, it's a recreational use. They go to parties to be social. I think for a lot of people, they probably don't know what would be considered heavy and regular, that might eventually lead to some level of dependency. Do you have a rule of thumb of what would be considered a regular or heavy use of alcohol? Is a glass of wine every day going to eventually lead me to being addicted?
So probably not. A glass of wine or a couple glasses of wine. The One of the things that we're learning is that there are a variety of negative health effects that alcohol has, and that those negative health effects can be seen in people who drink less than what we would consider to be dependent or addicted. So the National Institute on Alcoholism and Alcohol Abuse has guidelines. Those guidelines generally are for men, no more than 4 drinks at any one time and no more than 14 drinks a week. For women, it's no more than 3 drinks at any one time and no more than 7 drinks a week. So those are our guidelines for non-hazardous use. If you use it in excess of that, you're not necessarily going to develop sort of an addiction, especially with alcohol, because alcohol, while alcohol can lead to becoming dependent on continued alcohol use, that process really requires fairly heavy drinking for fairly long periods of time. That's not necessarily true with some of the other drugs. So, if we're talking about cocaine, or if we're talking about, obviously, with opiates, the addiction can develop much, much faster with much lower doses in a shorter period of time.
And I believe, I guess, as to your point, is that different people have different susceptibility to potentially developing these dependencies. Do you have, I guess, risk factors for people to consider whether to look out for themselves or for those around them, that this person might be more likely to be susceptible to this, and therefore maybe I could be a much more mitigating factor on this issue?
Right. You've mentioned, and a lot of people are aware that there's a genetic component. Of course, nobody knows exactly which genes those are, or what aspect about that is responsible for the effect. But basically, if you've come from a family where there's been significant alcohol problems in your parents, or in your aunts or uncles, that's usually a sign of some kind of susceptibility, either genetic susceptibility or maybe sort of just the family environment. We know that kids that are exposed to alcohol early are more likely to develop problems, even if it's just a few drinks, or a few sips when they're younger. So those are some of the susceptibilities that are just relatively obvious.
When you think about, I guess, using alcohol, we talked about briefly, it being recreational, and that for some it's around alleviating symptoms that they have on mental health issues that they do have. So what does the research show, or have we learned about people who are turning to substances, whether it's drugs or alcohol, to self-medicate? And in that context, what's the best way to break that cycle to get them to the point of actually getting the right type of help?
in terms of self-medication, a lot of times what we're thinking about is that they're anxious in a situation or they're stressed, and they turn to that as the way to cope with that stress. And stress is really the big one that we think of for the most part. Um, but there's other ways of coping with stress. Um, and some of those ways are positive and some of those ways are negative. Some people deal with it by exercise. Some deal with it cognitively. Some deal with the stress directly by confronting the source of the stress. So the largest thing is being able to help people to understand what it is that's creating that stress and help them develop alternative ways of dealing with that stress. Some of those ways involve, um, as I mentioned, finding alternative behaviors that can be effective in distracting you from the stress. Um, One of the areas that we're very interested in right now is mindfulness meditation as a way that can help people deal with stress as well as deal with other um, uh, be- behavioral health kinds of problems. And so being able to rely on those approaches to address stress is really important.
So, if I'm understanding you correctly, are you saying that if I am really stressed and I am at the point where I am really relying on alcohol as a way to go to sleep at night, that if I just learn mindfulness meditation, I would be able to overcome my addiction? Or is this something that I have to do before I become addicted?
Well, we have to go back to the fact that there's degrees of addiction, right? So a lot of people develop this dependency, um, and sometimes it's recognizable as having a certain time of day where they just feel like they really want to drink, and um, that's something that can easily be overcome by those kinds of coping things. Just first of all, you have to recognize that that's what you're doing and not automatically reach for the bottle. Um, but once you recognize those kinds of things, those you can address those kinds of things fairly easily. And for some people, it's as simple as giving them brief advice that the amount that they're drinking um, is is not healthy. You know, whether you consider it to be addictive or not can be irrelevant for some people. It's just that the amount that they're drinking is not healthy, and how can they develop more healthy ways of dealing with alcohol? Um, as the dependency addiction gets more and more severe, um, you probably are going to need some kind of treatment, and there's lots of different kinds of treatment that some of it involves medications, some of it just involves more intense sort of coping skills training, um, uh, training in being able to avoid relapse situations. Um, so the ease with which you're able to address the addiction really depends on just how addicted you are.
And is this something that either myself or the people around me would be able to self-assess, or is this something that I have to go to a doctor to figure out what is the level of dependency that I have?
So there actually are some scales that are online that you can take, some questionnaires, and that will give you a sense of just how your drinking compares with other people's, and how your level of problems compares to other people's. For the most part, um, we judge person's level of addiction by the extent to which they have problems that that relate to the alcohol, and not so much the degree of craving. Um, uh, so I like to think about it in terms of the degree of craving, but that's a really difficult thing to assess. But if you are giving up specific activities in order to drink, if you're spending a lot of time getting alcohol or recovering from the effects of alcohol, then you probably want to get uh, some formal assessment as to just what extent you have a problem.
I guess that's a really good way to transition to some of the work that you've seen, which is the impact of alcohol on marriages, on families, on child development. Maybe you could share a little bit on what you've learned in your time researching in this area.
So when we think about alcohol in families, it's a fairly complicated situation. Um, One of the things that we know is that many people begin to reduce their drinking when they enter an intimate relationship. Either they get engaged to get to be married, or they get married. People who don't reduce their drinking sometimes then reduce it when they have children, and the additional responsibilities and their view of those roles a lot of times will have people change their drinking in a way that's much better for them. For people who don't change, it's a little complex. Um, Marital satisfaction, the happiness they have experienced in their relationship, is really dependent on having a partner who's drinking the same way. So one of the sort of unfortunate findings that we've replicated many times now is that couples who are both heavy drinkers, and at a level that we would all consider to be really unhealthy, are very happy with their relationship. Um, and they're just as happy as two people who are very light drinkers or who are abstainers. The people who are unhappy with their relationships tend to be people who one person's a heavy drinker and the other person's a lighter drinker. Now, just because two heavy drinkers are happy in their marriage doesn't mean that their raising of their children will be um, unaffected. Um, Another thing that we've learned is that families that have one person who has an alcohol problem or has both people with an alcohol problem, the children are affected right from the very beginning. So one of the things you'd like to see in children is a secure attachment. Secure attachment is that if mom or dad leaves the room, they may be upset, but when mom or dad come back in the room, they're easily calmed down, and then they go about and continue exploring the room. And kids with secure attachments have much better advantages over time than kids that have sort of the insecure attachments. Father's alcoholism has a major impact on that the mother and child's attachment. The stress of that family creates a situation where it impairs the mother's ability to have a secure attachment with the child. And over time, that has negative influences, and it has influences in terms of the child developing the ability to regulate their behavior, and is related to um, subsequent problems in preschool and in middle school and subsequent drinking and drug use in high school.
Yeah, I think as you mentioned before, which is that um, life changes, whether that's an engagement, the birth of a new child. Often these milestones could serve as the turning point for some people to say, actually, I don't want to smoke anymore, or I don't want to drink anymore. So I'm sure some of our listeners will potentially be considering some of that as they listen to our conversation. Maybe you could share a little bit more about what are the advantages of, children who do have secure attachment, who are able to regulate their behaviors because they have a family that doesn't have high alcohol use.
Yeah, so we just step back for a second and just say that it's not just that people reduce their alcohol when they get married. A lot of times they reduce their smoking, and having a child also leads to reductions in smoking, and it leads to reductions in cannabis use, and it actually leads to reductions in criminal behavior as well. So the effect of getting married is really very healthy. Um, and and I should say that um, that recently we've seen evidence that that's true whether you're in a same-sex marriage or an opposite sex marriage. So that that intimate tie really provides a very strong basis for engaging in sort of um, healthy long-term behavior. Now, as to the positive and negatives of secure versus insecure attachment, so one of the things that is important about secure attachment is it provides the foundation for emotional learning and for developing um, the ability to restrain your impulses. So in a study that we did with my colleague Rena Iden, we had children who came from families where the father had an alcoholic problem or they didn't have an alcohol problem, and we looked at their ability to um, not eat an M&M that was placed in front of them. Right? And what you find is that those kind of restraints are stronger among kids who are securely attached and stronger among kids who are coming from families that do not have alcohol problems. That ability to restrain those impulses has major influences when they get into school, because school involves restraining a lot of impulses. And your ability to get along with other kids depends on your ability to not be aggressive and to engage in pro-social behaviors. To the extent that you're not able to do that, you're going to have a difficult childhood.
Yeah, I love that, as you said, that these positive emotional ties end up being a real catalyst for more healthier behaviors. So you mentioned before that, one of the first steps is recognizing what you're doing rather than just automatically reaching for the bottle. I mean, I know that you don't know what you don't know, right? And so for a lot of people, it's actually just a lack of self-awareness of this situation. So are you, I guess, from what you've seen in the research, are there techniques that people can learn to build that self-awareness, or is it more just that you need to be surrounded by people who would raise the issue with you as the more likely way to move forward?
So it really is important to be in a social milieu where people are not engaging in excessive alcohol use. That tends to be really protective. Um, so if you have a partner who doesn't drink or drinks lightly, that tends to be protective. If your friends don't drink or drink lightly, that's effective as well. People who indicate that they have a bunch of drinking buddies, that tends to create problems. It's associated with problems, alcohol problems 4 years later. So the social milieu is really important in terms of one, setting norms for you in terms of how much you're going to drink, but also when you're drinking, constraining your behavior. If you go to certain bars, right, that some of those bars, um, they're very people there are very well behaved despite the fact that they're drinking, and then you go to other bars and people are not, and that really has to do with the social rules that are either enforced or not enforced in those different settings.
So I guess if we come back again to like, wow, how can an individual be able to recognize that they are maybe engaging in unhealthy drinking behavior? So obviously, as you said, one is be really conscious of what your environment is around you. It still comes back down to, do I even know what that looks like? So for example, we know in areas where people tend to be more obese, it's because everyone else around them is also obese. And so that is a normal for them, and they're not engaging with other people who are maybe in a healthier body mass index, for example. So one is like, how do I even know that that this is the case? Do I have to be in an environment where someone would tell me, actually, you're going to bars that is a little bit excessive, or you are drinking in a way that's a bit excessive, or will I develop this skill and awareness myself?
So, so people who are listening to this podcast, they're right now they're thinking about their drinking, and that's good. And as I mentioned, there's things online that can help them decide whether their drinking is healthy or whether their drinking is not healthy. For other people, we think of we think about motivation for change as having a variety of different stages, and one of those is the pre-contemplation stage, where people are not even thinking about that. And moving them to the contemplation phase is something that we're very interested in trying to understand, but it's not entirely clear why or how you do that. So, research that one of my colleagues is doing is focused on um, social behaviors that spouses engage with their partners on to try and moderate their drinking. So, for example, um, and trying to understand which of those are effective and which of those are not. So, saying something like, you know, sometimes it's really embarrassing if you drink too much, and I want you to be healthy, and so, you know, we should talk about that. So that might be a best way, or it might be that a better way is saying, um, you have to stop drinking or our relationship's not going to work. Um, there's a little bit of evidence in that regard that seems to suggest that letting people sort of experience the natural consequences of their drinking and not protect them from that is sort of helpful. There's work by Bill Miller um, and some folks at the University of New Mexico that describes interventions that um, help partners to um, behave in ways that can lead their partners to be interested in treatment. Right? And a lot of those things really involve not getting in fights, not getting in arguments. One of the things that's really detrimental in terms of the relationship is developing accusations and fights over the drinking, and as opposed to being just dispassionate about it and saying your drinking is having a bad effect on you.
Yeah, that's a really great tip. So basically saying, how can you be as objective as possible? Try not to get personal with people's character and saying you're a bad person, but actually just really focusing on the problem, especially in the context if someone is in that denial or pre-contemplative phase. Do you have any other tips beyond not getting into fights and being objective to help people be approach the conversation?
So it doesn't help to approach them when they're drunk. Okay, that would seem to be sort of common sense. It probably and so some of this is just opinion, and some of it's not necessarily. It's based on research, but not tied to research in an explicit way. Um, Sometimes it makes sense to approach them when they've had some kind of negative experience with the drinking, where they were really sick or they don't remember something from the previous night, and express your concern. You know, we had a great time last night until, you know, you passed out. And, you know, I want you to be able to remember these times, and I want you to be healthy for a long time. So those are the kinds of things that I think would be um, helpful. And it's maybe easier to do in the context of a marital or an intimate relationship that's still positive. And so trying to maintain that positivity and looking at the positive sides of them and not just at the negative sides is an important element as well.
Would be great to get your perspective on, you know, how do you know when it is time to approach your partner in this conversation? Because as you said, while the relationship is positive, you put up with these things and you say, oh, it's fine. It's just one extra drink. Or sometimes he blacks out and that's fine. You know, I'm always there to be the sober driver. And so what would you consider as like, this is the time when I really should start having the conversation with them while my relationship with them is positive?
It's so I think it's that's going to vary for, you know, each individual person as to when they feel that that's when it gets to that point. And it certainly ties into how much they drink, right? So, if you are also a heavy drinker but you're not having problems, then maybe you should be looking at what you're doing and whether there's ways that you can scale back on your drinking and serve as a positive model. Um, so the uh, so that I mean I guess I would say it's that there's not any one specific point where you would say, okay, I've had this, now I need to say something. The conversation should be continuous, right? If somebody has let's just say, has a night where they drank too much, um, saying, that was, you know, you're not feeling very well now, are you? And and you know and expressing that concern early on and not waiting for some specific big event, right? Expressing it from the very beginning, and trying to model that kind of behavior from the very beginning. It's problematic if you let it go for a real long time, and then all of a sudden you say, I'm really concerned about your drinking when you've just had your, a DUI, for example. You need to be expressing those kind of concerns when they engage in like really excessive drinking, or when they've had a really bad experience because of the drinking.
Yeah, that sounds good to kind of put in perspective. It's just actually, I think they said something that even when buying an item, you need to be exposed to the item 7 times before you're ready to buy the item. So you could imagine getting someone to change, in some ways, entrenched behaviors. It's not that you say this one thing and suddenly they're enlightened and they're going to stop behaving the way that they are currently behaving, but it's just regular, supportive, non-judgmental conversations, and I assume it would be at times people would still be a bit defensive, or they might be saying like, "Oh, that's not as bad as you make it sound," and you just have to be persistent in this context, I assume.
Well, I think you raise it. You say, well, it was of concern to me. Your behavior was of concern to me, and in the context of us still having a positive marital relationship, saying something like, um, I appreciate you, and the things we do together, and I want that to continue, and I don't want that to be cut short. Um, I can tell you that most people have know somebody who either had a DUI or had an accident, or had a major health problem because of drinking. We know that statistically, and those people don't necessarily have to be alcohol dependent or alcoholics in the way we typically think about that behavior. A person drinks too much and they drive. That's a dangerous thing that you should intervene on the very first time if you can't prevent it.
Yes, and just to kind of clarify for our listeners, the acronym DUI just means driving under the influence of
Right. Sorry.
alcohol
Yeah.
or substances.
Yeah.
I guess, would you approach it any differently if someone is, severely addicted, where they're always drinking? And so, as you said, try not to approach them when they're drinking. So if they're always drinking, how do you have that conversation?
You know what? That's one of the toughest questions that I get. I there I've gotten questions before about, well, my son or daughter is using heroin. What can I do for that? Um, and there was a time where people had this idea that, um, well, you should just cut them off. That you should just engage in what they would call tough love, right? And uh, cut relationships with them. And that's a bad idea. People do recover. They do need to get access to treatment. Um, and you need to maintain your relationships with them, but you also need to protect yourself so that you're not being taken advantage of by them. So to some extent, that's this notion of, they're going to have to experience the consequences themselves, so that, if they get arrested for possession, you can be there, you can support them and you can love them without necessarily saving them from those consequences, you know. And one of the things that we know for alcohol treatment and for a lot of other treatments is it doesn't necessarily take the first time. That that people often engage in three, four, five sessions, three or five, not sessions, but three or four or five treatment episodes, um, where they might be seen for a few months and then they do okay and then they relapse and then they go back into treatment. And a lot of times it takes three, four, five times before it will be effective. But it does work, and there's a lot of people who do recover.
Yeah, maybe this is a good transition. If you could share with us some of the common treatment options that are out there. So there might be someone who's listening right now who doesn't even know what should I do. What is rehab? Yeah, if you could tell us a little bit more about that.
In the United States, people have the option of basically an outpatient, um, where they would be seen, once a week for a number of weeks. Usually, that can be anywhere from 6 to 12 sessions. That seems to be pretty effective for people who are on the mild end, of severity, um, with regard to alcohol. It's probably not going to be effective for people who are um, involved with heroin or cocaine. It probably would be effective for people who have concerns about their cannabis use. Would be an outpatient stay. Then there's also inpatient and rehab. And so inpatient, in the United States, is usually a 21 to 28-day stay. It's meant to give people a respite from the environment that is providing them with reasons to drink, and give them an opportunity to work through whatever withdrawal they have before going back out. And then normally that's followed by uh, some outpatient contacts for another, usually something on the order of 3 to 6 months. Residential tends to be longer term. That's really difficult because that's extraordinarily expensive, and in the United States, uh, only the people with the best insurance are able to get that. And that usually involves separating people from their community for, as much as 6 months. Um, so those are, and then within that, there's a lot of different things that people, techniques that people focus on. Cognitive behavioral therapy is an important one that's been shown to work. Motivational interviewing, particularly for people who are less severe. And there's a couple of medications that seem to help people with regard to alcohol, and certainly there are medications that help people with regard to heroin or other opioids.
Yeah, great. Thank you for sharing that. And I think what you're saying is there is the step care model for where for some people, once a week for say 6 to 12 sessions when you're in the milder end of the spectrum, that is something that you can work through with, as you said, maybe some motivational interview therapy. And then inpatient in this context usually is hospital based, and then residential rehab is usually in the community, not in the hospital, but as you said, it's usually an extended months-long stay that usually has to be self-funded, unfortunately, because it's a very expensive and not many insurance companies will pay for it. And yeah, I just wanted to remind that Clearhead is an EAP provider, and so if your employer uses us, most employers fund these outpatient rehab weekly sessions. And we have basically clinicians who are trained in providing drug and alcohol recovery and rehabilitation. So yeah, it can be funded through Clearhead if your employer uses us, basically. So just want to remind people that there is an option from that perspective.
There's also the importance of support groups after you've finished treatment. So, Alcoholics Anonymous, or for a while there was something here that's called Narcotics Anonymous. I think it's still um, um, something that's prevalent here. These are groups of people who are in recovery that can help guide people through the tough trenches. The issue with all of these substances is not stopping them. It's whether you can stop them for a long period of time, and the issue of relapse. And there's a lot of wisdom among people who've been through it multiple times in terms of what kinds of things can facilitate a relapse and what kinds of things you need to avoid.
Could you expand a little bit more on that? Like, what are common things that someone should be mindful of having come out of, a rehab situation? Because I could imagine, as you said, 3 weeks away where you're not exposed to the environment, all fine and good. But if you don't change the environment, you're just going to relapse back into the situation.
So I can speak, mostly about people with alcohol problems, that they go back in and to the community, they go back into their home, and they're around people who are drinking. And there's a gradual process that comes to think, well, maybe I could just have one, or maybe I could have a couple, maybe I can be a normal drinker and not have problems. And that's been shown that can happen for people. And again, probably more at the milder end of the problem. Um, but um, the exposure to alcohol is one of the things that you have to be concerned about in terms of relapse. Um, the way you deal with that is either in treatment or in the support groups. You talk about, well, what are you going to do when you walk into to somebody and they hand you a drink? How are you going to address that? Nobody wants to say, yeah, I have a problem with alcohol. I don't want to drink. I think it's more and more common now that people will say, I'm sorry, I don't drink. But being prepared for the subtle pressures that your friends may put on you, or even the subtler pressures that may come about just because your spouse has wine with dinner. And so that is really the having a plan for how you're going to deal with that as you move into your recovery is a really important element to being able to recover.
Yeah, and I mean, I can speak from my own personal experience. So I'm not really an alcohol drinker, even since high school. And I remember it, obviously, as you said, generationally now it's shifted and there are more alcohol-free options out there. But I remember that people would always look at me really weirdly, like, how can you not drink? It's like air, how can you not breathe? And so yeah, and I would consider myself relatively secure in my identity, but still I feel pressure, and so I could imagine anyone else who's just looking for a little bit of an excuse. It's just like, oh well, I don't want to make my friend feel bad, which I actually think is a huge part of the social dilemma, which is I often have to remind people that just because I don't drink doesn't mean I'm judging you for drinking. Feel free to drink whatever you want. And let's just say I have the plan that I am just going to say no when I come out of rehab. But then obviously my partner, my friends feel bad that they're drinking in front of me. And then they start not inviting me to events or something because they don't want to feel bad that they're drinking around me. So how do you prevent, in some ways, social withdrawal, which is also a protective factor in some ways?
It may cause people to kind of reevaluate their friends, right? And whether your friends can be supportive of the fact that you've decided to change your behavior. And whether if they can't be supportive of that, then maybe that's somebody that you don't want to be hanging out with in alcohol situations. Um, I find I obviously have a lot of academic friends, and then I have a number of non-academic friends that we get together once a week. We play basketball. We go out after basketball. We go to a bar. We eat. Um, and there's no issue if I order a low alcohol beer or no alcohol, or if I just have one beer and I stop. Nobody says a thing, nobody thinks a thing. So I think it's just becoming more and more accepted that people are going to do what they think is healthy for them. And so I think that's the key for them.
Yeah, that's so positive to see that there is this cultural shift. I mean, the other debate as well is, do we do this sort of gradual reduction or do we go cold turkey? Do you have any research on what's most effective?
So if you're uh, if you're just mildly dependent, or you just think that maybe your drinking is not particularly healthy, there's no reason why you can't just go cold turkey. Um, Cold turkey is a big problem for people who are severely addicted, and they should not do that without medical attention. There's the possibility of having seizures. There's a lot of bad things that happen when people are severely dependent and they go cold turkey. But for the average social drinker who's decided that they don't want to drink, um, it's it doesn't matter. You can cut down gradually. You can go cold turkey. Um, the For a lot of people, it's just a matter of thinking about the alternatives. It's in the middle, like 9 o'clock at night. You think, well, I'm going to get up and go get a drink. Well, you know, maybe you get up and go get a non-alcoholic ginger beer, or maybe you get up and you make hot chocolate. There's a lot of other things that will satisfy that need, and it's just a matter of thinking of them and saying, well, let me try something different, right? And as we said, for people who don't have problems, having a drink here and there is not an issue. It shouldn't be an issue, unless they have specific kinds of health problems.
And I guess to kind of close off this part of the conversation around treatment, there will be some people who have, as you said, gone to multiple rehab sessions and it's not worked for them. So what next? If rehab is considered, I guess, the higher, more severe end of the spectrum.
It depends on what they're in rehab for. If they're in rehab for opioids, they probably should be in the United States. The thing we prescribe is buprenorphine. Buprenorphine um, um, has the effect of forestalling cravings, and it does so without making the person feel miserable. And they may need to be on that for a long time. So for opiates, that's a real common thing. In fact, in the United States, that's considered to be standard of practice for people with an opiate use disorder. For people with an alcohol use disorder, all you can do is keep trying. There's not a silver bullet that can address it for a person who's been through this multiple times. All you can do is hope that the next time it will catch.
Yeah, and I'd be interested to hear your perspective. We obviously talked about the cultural shift in terms of normalizing not drinking too much alcohol or no alcohol at all. Do you find that there has been a generational difference in terms of addiction? For example, less binge drinking or, yeah, be keen to hear your perspective on if there's a change.
So I think in the United States, there's been a reduction in binge drinking recently, particularly among adolescents and younger adults. I don't think that's changed very much among older adults, although the, the extent to which people binge drink declines as they get older, right? So it's very unlikely that you find a person who's 50 or 60 who's engaging in binge drinking. But that's just kind of an age and wisdom and physical experience of what that does to you that has an impact. But over the years, I think there's been a trend towards less binge drinking among um, young adults in the United States, particularly among men. Women have inched up a little bit, and the genders are engaging in sort of comparable levels, although it's really difficult to say that it's exactly comparable because there's physical differences, there's metabolic differences that determine how much alcohol actually gets into your system. So that's been a cultural shift. It remains to be seen whether cannabis, which is now legal in many of the United States, whether that will have an impact on binge drinking also. Um, I'm aware of people that have basically shifted from alcohol to cannabis, and that's their social experience now, and so they don't drink as much. But there are still people who drink a lot and still do cannabis. So it's um, it's not an all positive thing there.
Yeah, and of course, we definitely see with the legalization of cannabis that there is increased normalization and use. What is the research telling us about cannabis use that we should be mindful of, whether because we're using it ourselves or the people around us are?
So I think the one thing that we can say we know is that there's a lot more that we need to know. We do know that people can become dependent on it. It's not the same level of dependency. It's not the same brain system that's involved as alcohol or as other drugs. And so um, uh, the long-term health effects have just not been well studied, and it's been not well studied because it's been because it because of the illegal nature of it. So I, I think there's a lot that we don't know about it. I think one of the things that seems key is that it does, depending on how you use it, it can stay in your system a fairly long time. And like a lot of illegal drugs, you don't exactly know what's in it. Right? You don't know what's in it. You don't necessarily know the dosage. Now that will change as it becomes legal and people can purchase specific doses of you know quantities of THC and CBD in the cannabis, tetrahydrocannabinol and uh, cannabidiol. Um, so those things may change, but we're really early in that experiment at this point.
Look, you've given us so much great advice and feedback and tips on what it means to I guess, prevent substance abuse as an individual, how, as people around these individuals, what we can do. Maybe, as a final sort of question for you around the fact that, some of our listeners might be policymakers in government. So, what are your approach from the research around system level actions that we can take?
Gee, another one of those really tough questions. Um, so, um, so there's a couple of things. Um, I think it's really important to put effort into dealing with some of the worst drugs. So in New Zealand, that's methamphetamine. Here it's opiates. Um, I don't know whether this is the case in New Zealand. I know that in the United States, in a lot of treatment facilities, if you're in there and you test positive for cannabis, they'll toss you out of treatment. That's a very bad idea. Um, the other bad idea is severe punitiveness. I think that the one of the things that we know is that to the extent that we can help people engage in pro-social behavior, that will have a positive influence on their substance use. And so it's really important that you don't cut them off from the possibility of rehabilitating themselves and being able to engage in those kind of positive behaviors.
Actually, I'd love to, before you go, actually touch on your one final area of expertise, which is actually domestic violence. Sorry, I missed this earlier. But yeah, would love to hear a little bit on, the impact of alcohol on domestic violence.
So there's been research in virtually every continent on Earth except for Antarctica that demonstrates that domestic violence is more likely when one or both partners are heavy drinkers, and particularly when the man's a heavy drinker. It seems to be associated with heavy levels of intoxication, and it doesn't affect everybody that way, but it affects people who have generally hostile proclivities and generally impulsive people. It tends to have that impact on them. Um, we've seen that relationship. We've seen that in study after study in countries where not many people drink, in countries where a lot of people drink, in countries where there's not a lot of violence, in countries where there is a lot of violence. So, for example, that there's been the research in Japan that has shown that. There's obviously been tons of research in the United States that's shown that. There's been research in Turkey that has shown that, where you have a largely Muslim population where there's not a lot of heavy drinking. It's been shown in India. It's been shown in South America. It's a robust effect. It's associated with heavier levels of drinking and intoxication, and there's data that suggests that if you treat the excessive drinking and you successfully treat it, that the marital satisfaction increases and that the violence decreases. And so right now, it's one of the most effective things we have for reducing partner violence.
Yeah, always treat the root cause. And then actually, if we go one level down, which is treat the reason why this individual is using alcohol, for example, as a way of creating a form of dependency or self-medication. That's wonderful. Is there anything else you'd like to share with us that you haven't managed to cover today, even though we've touched on a lot?
Well, I did want to mention how much I loved my visit to New Zealand. We spent 6 weeks there in 2022. And we just had a great time and loved the hospitality of the people who were there. And I learned a lot about the Maori people. I spent a lot of time with Maori health centers and talking with them about some of the challenges they were experiencing. So.
Yes, and that's something we didn't even really touch on is the disproportionate impact on indigenous populations, which you also see in the United States as well.
You know what? You see it in lots of places that were affected by colonization.
Unfortunately, it's again, it's how do you address these generational trauma? Well, one final question from us that we ask all our guests, what is your one well-being practice, Ken, that helps you stay well?
Oh, basketball. I play basketball 2 to 3 times a week, and it's a social thing, it's a physical thing. I've been playing with one group of guys. As people age out, we get new people in. I've been playing with one group of guys for 35 years, so that's my thing.
That's it for today's episode. If you want to learn more about how Clearhead can support your workplace, or you have a burning mental health question that you'd like us to explore on the podcast, check us out at myclearhead.com and drop us a message. Love our content? Share it with a friend or leave us a comment on LinkedIn, Instagram, or Facebook. Thank you so much again for listening and catch you on the next one.